hesitancy is about a delay in acceptance or refusal of vaccines despite their availability. And so it refers to almost a complex context specific around things that are such as complacency, convenience, and confidence. And when you look at things like confidence, what drives people lack of confidence or to have confidence in vaccines? And the truth is, some of the things that have been uncovered include people's trust in the effectiveness on safety of the vaccines and the system that delivers them. And no doubt, when we're talking about COVAX, there's certain requirements, e.g. with the AstraZeneca vaccine, certain cold chains that need to be met that could make people feel either this thing is going to arrive in good state or not. And also tied with confidence is the reliability and competence, what is perceived of the health service and health professionals. And no doubt in the context of Kenya, depending on your location and the facility available, that will vary. Add to that the motivations of policymakers who decide on needed vaccines. So in Kenya, again, we see that there is generally a mistrust or lack of trust in government, and that's not in Kenya only, actually, it is a worldwide phenomenon that's occurring, and that will shatter some of the confidence that will lead to vaccine hesitancy. The second area of convenience is really looking at physical availability of vaccines. So in our case, Kenya does not manufacture any vaccines. And as of recently, when looking at carriers, airline carriers that could be used to transport vaccines where they're currently being made in the world, unfortunately, our leading carrier, Kenya Airways, did not meet the cut to be able to transport vaccines, which means in our case, we will be dependent on international carriers to bring in these vaccines. We're expected to get them in May, but that may challenge our availability. So the area of convenience could be difficult, especially when it comes to getting the quality of service or getting product. And finally, on the area of complacency, complacency is something we have seen, I think, from the onset of the National Business Compact, which I'll go into quite a bit. There has been complacency in terms of people's disbelief about COVID. Does it really exist? You know, is this just propaganda that's being spread? And therefore, the perceived risks of a vaccine to prevent this spread is seen as low. And therefore, people may not be that endeared towards taking the necessary preventative measures. So when you look at this vaccine hesitancy, what we get to as one of the effective ways of combating it is vaccine literacy. And this occurs when people understand in their own language and relevant to their context, the processes, systems that are needed to access and get vaccinated. And it means people getting to an understanding, knowing how and why this vaccine works and the disease it's preventing and their value and the value of that vaccine to themselves and to society. So when we look at the COVID-19 vaccine, there have been some serious studies done already that are showing that about a third of the population in Kenya, at least the latest report I saw, are infected. And therefore, there's a question around, are we getting to herd immunity or not? But important to add to that is really the attitude of people towards vaccines and a need to actually emphasize that even as we see the virus mutating, vaccine is an important part of the journey of living with COVID and keeping our population as healthy as possible. But it isn't a one-stop shop. And it is a conversation that we need to keep going so people understand what vaccination with COVAX will mean for them. And now I'd like to switch over to CONVINCE. So CONVINCE is an acronym for COVID-19 New Vaccine Information, Communication and Engagement, which is a global organization that is stemmed from the US, whose initiative is on understanding of factors that influence people's willingness to accept COVID-19 vaccine. And they look at doing that through an inclusive public dialogue to reduce vaccine hesitancy. So Convince is really formed by three founders. There's the City University of New York Graduate School of Public Health, Scott Ratson. He and Heidi Larson from the London School of Hygiene and Tropical Medicine, as well as Nancy Lee from Wilton Park, an agency of the UK Foreign Aid, Commonwealth and Development Office. They came together and saw the need to start this non-profit way of engaging the world on vaccine, the COVID-19 vaccine. And their mission is to encourage sufficient global vaccine acceptance in order to achieve a level of population immunity needed to curb this pandemic. And so they see because the area is around communication, they see four things that come in the way of effective communication on COVID vaccine. First, I mentioned earlier, is the lack of public trust in government information and about COVID-19. So that's been seen in most parts of the world. Second is an interesting phenomenon. It may not be as prevalent here in Kenya, but it is so in especially the developing countries, is the opponents of childhood vaccines. So people who do not see why there should be childhood vaccine, who are quickly and aggressively spreading disinformation about COVID-19 vaccine. So they're aggressively going counter it. And then there is another cohort, which I also mentioned, which is denialism, that COVID virus and disease actually exists. So that's one big area around communication that needs to be addressed. And finally, they have seen generally that there is inadequate investment in communication programs that will prepare communities to accept this vaccine based on social research. And so an opportunity to develop messages and identify what are the relevant pieces that will make people understand in the context of their society. And so what is Convince doing right now? Convince is approaching vaccine hesitancy in a way that is about driving public listening and communication analysis. So they want to engage networks and the public to listen before they propagate, to understand what are the communities talking about, what are their fears, what are the myths that are going out there, how can they distinguish those from the facts, how will it land with this community? And then based on that, they're looking to design interventions. So they're looking at how can we take what we've heard from this community and create clear communication around it and find a creative way of disseminating this. And they see a need to engage with a multi-sector of partners. They know the power of tapping into existing networks and building trust, or using the trust that the networks have already engendered in order to allow them to share and communicate with the communities there around the truth about COVAX. So as of now, Convince is barely, I think, 6 months old, and it's rolling out an employee survey as we look at employees going back to work, as everything starts to go back in some countries. Employees going to work is going to be a big issue. So Convince is rolling out a global survey to look at employees' sentiments on the vaccination. And this does pose an interesting question about what are employers going to ask of employees, if at all, around coming back to work with regards to the vaccine. And now I'll switch over to the NBCC, something that President Ritesh asked me to talk about, and I wanted to keep it for this presentation. And so the NBCC, as you heard from Ambassador Josephine Ojambo, is under the leadership of the Kenyan government and endorsed by the UN family. And the NBCC was formed just 3 days after the first officially announced COVID-19 case in in Kenya. So that was March 16th, 2020. And the NBCC's mission is to improve hygiene practices and contribute to protecting lives and livelihoods by limiting the spread of infections in Kenya and across Africa. And our mandate is really around accelerating local action and supporting government efforts and countering the coronavirus pandemic. And we would not be able to do this without this multitude of partners. You can see that it's a rich tapestry of players, from competing global local soap manufacturers. We've got communication agencies who have been at the forefront of delivering and developing our communication behavior change communication. We have digital and tech organizations that are helping us to get into the digital space and have peer-to-peer interactions and find ways to connect with different sector and strata of society. We have non-profits, we have funders, government ministries, as I said, and collectively, these entities have brought to the table a breadth of knowledge and experience and ability to leverage existing networks. And what that has resulted is, in a relatively short time, NBCC has been able to deliver with private sector speed, scale, and creativity, while leaning on the NGO and developmental partners and philanthropic organizations' ability to have impact at a community level. So impact-driven interventions have come together through this wonderful network that has come through the NBCC. And some of our achievements, just to give you quick highlights, are from the time we were formed in March, we were able to raise $1 million in cash and kind contributions, largely from Kenya, and about $3.7 million as a DFID Unilever grant via AMREF to deploy hygiene, behavior change, communication, and interventions across Kenya, Uganda, Tanzania. And with that, we initiated the Commercial Corona media campaign, which had a reach of about 1.8 million households through TV and radio, and 10 million people through billboards. That was the first campaign that was just driving awareness about coronavirus. And that has since evolved. We have since gone into understanding that while the economy is reopening and the pandemic lingers on, that we need to remind people about adopting the right set of behaviors. So what are the motivations we can give people so that they can take action to protect themselves and others? And I want to recognize Ambassador Josephine Ojiambo for her work in making sure that this information and communication is actually cascaded even to more vulnerable groups, that is people with disabilities, and helping us to make sure that our messaging does not get left out from different groups. And besides that, I did talk about hygiene interventions. We worked with the government to identify hotspots across the 47 counties. And we were then able to work with our partners to set up hand washing stations and provide over 100,000 masks and over 300,000 bars of soap to make sure that people had the ability to practice what we were preaching. And so the NBCC understands that it's not enough to put our efforts on the hands, masks, space piece of coronavirus. We are currently conducting a vaccine hesitancy study with our partners, AMREF. And the study's main objective is to determine the key issues, that is, what are the gaps in knowledge and attitudes on COVID-19 vaccine amongst the youth in Kenya. Kenya's youth is about 75% of the population. Social media, where a lot of misinformation and disinformation happens, is where they spend a lot of time. And we want to listen in, understand, with a view to developing communication that will be able to speak to the audience and provide them with facts and give them vaccine literacy. And so to me, giving you a snapshot of what these two organizations are doing, my call to action for you as Rotarians is threefold. First, I'd like us to look at communication and engagement. And the goal here is to ask you, what role can you play in terms of increasing vaccine literacy and boost confidence so that you ensure that information gets out there to solve for the disinformation and misinformation people are getting? How can you, through your business organizations, through your networks, get unlike people to speak to each other on vaccines and just understand varying perspectives and see how to bring that together with the knowledge of the truth and the facts about the COVAX? And with that, from your organization perspective, many of you are business owners. You run great businesses, or you work within school setup. Like I know that Ambassador Jambo with UNICEF is looking at schools and working with UNICEF in the school setup. How can you develop materials to meet different audience segments? So how can we help people learn at the level they can understand, being cognizant of their education level, or are they employers or employees? How can we help people know and create a set of vaccine information? Let me call it COVID Vaccine 101, or for dummies, that people can refer to so that whenever they get disinformation or misinformation, they know how to counter it and they can spin it on its tail. So I encourage you to take on an engagement and communication aspect to that. I also encourage you to look at your role as advocates. How can you take on advocacy on vaccine literacy? So the goal here is not only to let people know about vaccines, but also to see how you can support equitable distribution of vaccines so that all people, no one is left behind. What role do you play? What influences do you have, be it at government level, at business level, at societal level, that can help vaccines get on the ground and get to the people who need it most? And what role as you as Rotarians can play as ambassadors from different strata of society? You represent all of Kenya coming together in this beautiful organization and movement. How can each one of you speak to the community that you represent and help people to understand, bust the myths and deliver facts on vaccine hesitancy and vaccine literacy? And finally, you have great fundraising capability, and fundraising and funds are required in order to boost research, to understand public perception, and identify information gaps and needs so that we can develop culturally relevant context information that will resonate with our society, that will help them see the value that COVAX brings to them and to others. It's about protecting yourself and others. And with that, again, I will ask in the society, in the groups that you move in, is it possible for us to look at piloting and developing proof of concept? I go back to the school scenario. Is it possible to do a quick pilot that can help us understand what will drive vaccine literacy in schools? What will drive vaccine literacy in employment sector? What will drive vaccine literacy across? And then see how these can be escalated and scaled, figure out what are the triggers for doing this right. And so that's my challenge to you and my call to action. And as I wind up, I do want to say thank you at the NBCC, very welcoming of partners, and we're very proud to have a Rotary through Ambassador Ojambo represented in a very strong way. And I do want to end with a quote. I may paraphrase it a little bit. And my quote is based on an African proverb that says, if you want to go fast, go alone. If you want to go further, go with others. And so I welcome you to join us in taking the vaccine literacy further together. Thank you. Over to you, President Ritesh.
Thank you so much, Ms. Maggie, for this very enlightening talk you have shared with us. And I'll be grateful if you could share the slides with us as well. Thank you, Ambassador Dr. Josephine. for your wonderful engagement with the NBCC, and for making it possible for us to have a wonderful speaker today. There are a number of questions which have started coming into the chat group, and if it's okay, can I please request Dr. Michael Hopkins to kindly go first with his question? Dr. Michael Hopkins?
Maybe my video's...
Professor, are you with us?
I am, but seems my sound not working.
Right. In that case, would you mind if I read out the question?
That's fine.
The question
Can
is...
you hear me?
Yes, we can.
Yeah. Oh, sorry, I'm having some...
Right. So, Professor, if it's okay with you, I'll just read out the question. Every day, the Kenya Health Service issues data on testing and incidences of COVID. They use a survey of 2,000 to 7,000 daily. How representative of the country is this sample? Do they only sample people who ask for tests, or only those in high risk or even low risk zones? Also, since it might take a day or more to get a result of a COVID test, how come the results are every day for the past 24 hours? Thank you for your informed answer to this crucial question that has so far been ignored in the Kenyan press.
Thank you. So, President Ritesh, do you want to ask one question at a time, or you want to read the questions?
Why don't we do this? I'll have past President Leah ask her question too. Sorry, you're on mute. Past President Leah, you're on mute.
I'm coming. Sorry. Yes, I said that would have been my question as well. It seems in Mombasa, everyone has let down their guards because they believe there are now so few positive cases. It must mean that COVID is come and gone. Who is now being tested in Mombasa? Obviously, most tourists are allowed to enter only with a negative test. Coast General is only allowing people in if they're extremely ill and reluctant to test unless all signs are there. How many asymptomatic cases are walking around? Nobody's wearing masks in Nyali. And my maid the other day, she had really labored breathing. I sent her by taxi to Coast General, and they didn't want to let her in because they said it didn't seem serious enough because she didn't have a high temperature. So, you know, so who are they testing? And then I had another question on top of that. Why, when you said so many conspiracy theories here in the coast about the vaccine, about the government, about, you know, stealing, you know, propaganda to steal money from the WHO and the politicians. And, you know, there's a general reluctance to childhood vaccines. But when I try to talk to my friends and of all walks of life, you know, like, didn't they get their kids vaccinated against, you know, cholera, smallpox, TB, MMR, you know, and they did. So why is this? Why do they really think it's so dangerous to do this?
Quite agree.
Sorry.
So, Ms. Maggie,
President Ritesh, do you want me to?
Yes, please.
Okay. Okay. So I'll start with the fact that while the NBCC works with the government or is supporting the Ministry of Health, I am not privy to specific information around the COVID testing and the protocols that are used around it. So I'm afraid that last question about why do the tests get done the way they're done isn't something I can answer right now. But what I can speak to is around the myths and facts, what was just mentioned by the last speaker regarding why are people not in belief about this COVID being real. And that is part of the misinformation that social media has propagated. and the disinformation that is being sent, as you said, about vaccines and people being willing to take vaccination as children. I mean, in Kenya, it's established, you know, your child needs to go for vaccination. So why are adults suddenly believing that there's something sinister? And you know, China has even developed a vaccine, and it's one of the big pushbacks that nobody wants to take a vaccine from China because they are the ones who created the coronavirus in the first place and are out to finish populations elsewhere. So before I invite Dr. Jambo to speak specifically around the clinical details, I do want to say that in reality, this is what we need to fight with vaccine literacy. And it is the purpose of why we approach with the NBCC, we go from peer-to-peer communication all the way to mass media. How do we have that dialogue with people and then listen to what they're saying and find a way to get to them in a way that they will understand, that's relevant to them, so they can stop believing what is being propagated and shared widely and understand the concern and the steps that they should be taking. One of our partners, for example, iFluence, actually has influencers who, some of them have had COVID, and they do talk to people, and they have shown, like, here I am. They're doing it virtually. So they show from the time they got symptoms to here's what I'm going through. This thing is real. So really giving life stories of their own encounter. So it is no longer a story for someone else. But I do echo the sentiment that there is concern, and remember the first slide I shared, or second slide I shared, about mistrust in the government and mistrust in people, belief that COVID is coming through, because in many ways our health facilities are still rudimentary, need to be built up, and people have this perception that what is being given to them is not something that is for their well-being. And maybe now I can ask Dr. Jambo to speak a little bit about the clinical aspects of COVID testing.
Thank you very much, Maggie. I'll just add a little bit to Maggie's very comprehensive answer. And someone has asked if the daily reports are representative. So I'd like to say that they are not fully representative. That's the truth. And probably why would be, one, I'm not sure about where in particular they take that sample. But if they did it within counties, we know that probably in some counties, they may have tested 5 or 10 persons. And these are probably people who presented. So they are a select part of the population. So there's a bias towards a particular kind of person who wants to go and have a test. Why would you want to go to have a test? Definitely because you have the information, you have been educated, or maybe because you're traveling. There are many more who can't access that service. It's too far, they can't pay, there are myths and misinformation that are causing an obstruction to accessing the service. We also know the kits are not available. I want to say testing takes place both through the public sector. Testing is being undertaken by KEMRI, but there are more tests being undertaken by Nairobi Hospital and even at AMREF. The question is how many Kenyans can access those services? The test that is commonly being done is the PCR, which all of you have heard about. And this PCR it's valid for about 96 hours from the date the test is taken. It's used a lot for COVID testing if you're traveling. All ages are being tested. The validity is good even outside of our country if you do have a PCR. The turnaround time is anything from 8 hours today to 24 hours. So you can get a turnaround in 24 hours. As you know, it needs to be negative for you to travel, yeah? I even understand today that testing is being done at the airport if you need a test before you travel, if you're leaving the country or transiting through Kenya. I think basically that's what I need to add to get the discussion going. Thank you very much, Maggie. And I just want to say the whole issue of conspiracy theories, those are building up to actually creating a disincentive for our community of Kenyans to demand service and to demand testing. Thanks, Maggie, back to you.
Thank you, Ambassador Jambo. And over to you, President Ritesh, for further questions.
Thank you so much. Thank you, Ms. Maggie, and thank you, Ambassador Dr. Josephine, for enlightening us. This is very important information which we are receiving today, and we are grateful. There was a follow-up question by Dr. Michael Hopkins. How can we press the government of Kenya to give us more precise information on their sampling, who, what, when? It's very urgent. I think Ambassador Josephine did touch on this. Do you have anything to add?
On my part, I did want to highlight that there's a policy brief that has been done based on a survey in Nairobi City County that was done in November last year. And what it was looking at was the prevalence of COVID-19 in Nairobi, which was seen as 35%, which is at least 1 in 3 people in Nairobi have been infected or exposed to COVID-19. And it was also giving the mortality rate, which was that 3 in every 10,000 COVID-19 infected individuals have died within Nairobi, which somewhat puts Kenya's mortality rate based on Nairobi a little lower than in developed countries. And ultimately, it was showing that persons aged between 20 and 49 years were 2.5 times more likely to have been affected by COVID-19 compared to children. And men and women seem to have an equal disposition for that. And of course, as you can imagine, in densely populated areas and sub-counties in Nairobi, that's where they found the disease, or at least people having been exposed to the disease, showing up more. And actually, half of the households had at least one person who'd been infected by COVID. However, most of them had no evidence of past infection. So the disinformation, while we have done, the government is doing some research and creating some policy documents. They may not be doing it at the pace that we are expecting, but that information is being collated. And this piece of work is going to be done in other counties too, and ultimately help to inform the whole vaccine Gavi Alliance and some of the steps that are being taken towards, planning, monitoring, and evaluation, and just getting, prioritizing and targeting where we're going to survey COVID and how, when vaccines are available in Kenya, they shall be rolled out.
Thank you.
Thank you.
Thank you very much indeed, Ms. Maggie. Ambassador Josephine, do you have something to add to this?
Just to add that I think the strategy for testing of the ministry is actually targeted testing. And that's because based on public health priorities, what they're doing is that they're testing to guide interventions. So it may not be fully representative, but they have a number of individuals and groups that they want to test. For example, individuals that present at a service that have a case definition of COVID. You present with symptoms like COVID. Or healthcare workers, or households where a COVID positive patient has been identified, or trans-border truck drivers. So it's really targeted testing right now, and that's why the coverage isn't full around the country, not 100%. But also that I'm sure, given time, with the right inputs, including the testing kits, there will be improvement in terms of coverage. Thank you.
Thank you very much indeed, Ambassador Dr. Josephine and Ms. Maggie. We have all learned quite a bit today, and most of our questions have been answered. I would like at this point in time to kindly request Dr. Beatrice Kiptanui to kindly give a vote of thanks to our wonderful speaker for the day. Dr. Beatrice?
Thank you very much. I'd like to thank Maggie Rarieya for her role. Maggie, your role in leadership as the head of the Secretariat of the NBCC is a tricky one, and you have done us a lot of good by sticking with it. We're very pleased to have the privilege of your time, and that you have lent us your knowledge at this point when there's still so much to do, but you have achieved a significant amount. I want to just start off the vote of thanks by quoting Leonard Sweet, who said, "True leaders make their team members twice the person they were at the start," and that's self-evident, and you have demonstrated it, I believe, through the impact that NBCC and other partners are having at a time of unprecedented uncertainty. So we applaud you for the work that you're doing and the impact that you're having. And finally, I'd like to just reiterate the call to action specifically to the Rotary group here and our friends who have joined us, just to remind us that Maggie has asked us to engage and to use our skills in communication to boost the confidence in COVAC. Which is no mean feat, because we are victims and victors with social media. It serves us, but it also threatens the factual knowledge that is available. And I believe that healthcare workers like myself would have to step up and take a stand, because we have a duty to separate the myth from the reality. But all of us as Rotarians have a really key role, because we have the privileged place of having the trust of the communities around us. So I encourage us to do that. You've also asked us to be advocates in influencing the communities on vaccine literacy. That also is something that we've had the privilege of seeing glimpses of how far we can go in reaching out to the communities that would otherwise not have access to information or to the necessary care. So I urge us all as Rotarians to do so. And finally, fundraising, which we do frequently and successfully on most occasions. I needn't say much about that, but we thank you for your time, Maggie, and we appreciate your participation and your leadership role, and we want to cheer you on towards the next challenges ahead. Thank you very much.
Thank you. Thank you very much.
Thank you, Ms. Maggie, and thank you, Dr. Beatrice, for that wonderful vote of thanks for our brilliant speaker today. And we have with us our honorary Rotarian and ophthalmologist, Dr. Mukesh Joshi, who wants to say hello to everyone today. Dr. Joshi?
Hello, thank you, President. First of all, my apology to fellow Rotarians. I have not been attending since 2 months. But thank you very much for supporting me in challenging at ABC Place. And we are very well settled, almost settling down. So that is number one. Number two, President, if we have recorded speech of today's speaker, yes. Because I being one of the frontline worker, where we are 6 inches away from the patient all the time, we got so many queries and so many questions asked, and there is a lot of lack of information on vaccine. So if we can be in touch with her to exchange the view, because we get so many queries from the patient and we are a little bit concerned, I will really appreciate. And thank you again for all the Rotarians, especially Mike Eldon, Ritesh, Manu Chandaria, all for your excellent support. And I will make it a point to attend regularly. Thank you very much.
Thank you so much, Dr. Joshi. And yes, you're very right. You know, in the medical field, to be very close to patients and the closeness, especially during this pandemic, it's quite a concern. And we are grateful to Ms. Maggie for this wonderful talk, and also to Ambassador Dr. Josephine Ojiambo for not only getting us this wonderful speaker, but for also engaging Rotary at a level where we are part of this team of NBCC. And also, I'll have a word with Ambassador Josephine to keep us in the communication with Ms. Maggie, so that we can always have this front and back conversation. Thank you so much. with that, I'd like to ask everyone to kindly raise a toast. If you have something to drink, alternatively, hand to the chest. Today we had Rotarians from Rotary Club of Kikuyu, Rotary Club of New River Onslow, Rotary Club of Bahari Mombasa, and Rotary Club of Ambassadors, Nigeria. And this is to Rotary the world over.
Rotary the world over.
Thank you so much. And the meeting is officially closed. Do we have any Rotarian or guest who wants to share something?
I hope that can I say something?
Yes, please.
I hope that Maggie will, if she's not in Rotary already, will consider joining Rotary. And especially she's at the coast, but I know your club is also excellent. So I'm just saying that.
Thank you.
That's wonderful. Past President Arun, any thoughts about the talk today? Sorry, you are on mute.
Right. Oops. I had two thoughts, Maggie. One was, I would like to know what percentage of the people are negative. In other words, not leaning towards having a vaccine. Partly because we socialize so little. However, we still socialize on media or on telephone with our friends and so on. I have not come across anyone in and around Nairobi who has expressed his opposition to vaccine. On the contrary, like Mukesh indirectly said, maybe I'm in a different age group, you know, I mean, we're considered to be more vulnerable, however hard we try. So that was number one. Second one was, there are a number of organizations which could be very good partners to you. I, for a number of years, was very active with Kenya Association of Manufacturers. And if you consider and look back, manufacturing people employ anything up to 1.5 to 2 million of the people who actually get paid a good salary, as well as they have a KRF file. There are lots of Juakali people who earn well, but they don't have the file. An institution like Kenya Association of Manufacturers, Agriculture Society of Kenya have different bodies, export of fruit and vegetables, they have their organizations. Wouldn't it be a good idea for you to interact with them, because they already have a channel of educating, yes, more often than not, the senior people in their organization, but who in turn could also educate the people below. So those were the two things. Ritesh, President, thank you for asking me. Thank you.
Thank you so much. Those are very valuable questions, and I'm sure Ms. Maggie will have something to say about them. Dr. Joshi?
Can I ask a simple question to Maggie? Maggie, sorry, I missed your excellent talk. I'm an ophthalmologist, and as I mentioned, we are very close to the patient. And globally, there is a lot of confusion on modality to deliver the vaccine to various categories. And I've been following very, very closely because my son lives in London and he works with Chelsea Westminster Hospital. I feel that UK has done the best thing. So can we follow their protocol? Because we are hearing so many rumors that it will be gone to Kenyatta Hospital or private hospital, or Kenya Manufacturing Association wants to play a very important role, because there are same challenges with Narendra Modi is also facing in India. The big country, all the vaccine available, India has managed only 0.6%. in spite of the fact that they've got a lot of vaccines available. So if we can do better than India and follow UK, I'm sure we'll do very well. I'd like to hear your opinion on that. Thank you.
Thank you. President Ritesh, may I?
Yes, please.
Okay, so on the very first question, I did mention that a study has been done so far in Nairobi that's going to be replicated in other counties that was showing 1 in 3 people tested seropositive, meaning that they'd been exposed to the COVID vaccine in some shape or form, meaning 2 out of 3 seem to be unexposed to it or have not shown any symptoms. So I hope that answers your question, Mr. Divani. And then absolutely spot on about how can we collaborate with other industries where there's already an existing network where we can drive that information and educate senior people. But before I go on that, there is another point I wanted to make. You're right that there's certain segments of society that are more accepting of the vaccine, and the older people, education levels have a lot to do with that. But we had a survey by one of our partners, Shujaz, who deals with youth, about 7.5 million youth that they engage with, and they found only between 20 and 30% of the youth would agree to be vaccinated. So they're listening to a lot of the media and the misinformation and actually pushing it back. So we see there's quite an opportunity to work with a cohort who can be carriers of this vaccine, and I mean of the disease, and they need to be brought onto the table. So I hope that answers that. Regarding the protocol, I wish I had such strong influence that I could get to the government regarding that, but I do know we have, from AMREF, we have Dr. Githinji Gitahi, the CEO, who's also part of this seat at the table when the discussions of protocol and other things are being made about the country. And these are sentiments that I will certainly share with him. And I'm sure that that is what is being looked at. What is the best way? How can we learn, not reinvent the wheel, but how can we learn from what's working and employ it as speedily and as smoothly as possible here. Thank you, President Ritesh, over to you.
Thank you so much, Ms. Maggie, and thank you to all members and guests who logged on today for this very informative and wonderful talk. Ms. Maggie, I have actually got a recording of this, which I will be sharing on our YouTube channel of the Rotary Club of Nairobi. And we are very grateful for your time. We are grateful to Ambassador Dr. Josephine for making this possible. And we do look forward to further engagement with you, because especially at this time, when we know that the vaccines will soon be rolled out, it's always good to be kept fully informed and in the picture. And you're going to be quite key in all this. So thank you so much. Thank you. Ambassador Josephine, would you like to say a few words?
I want to thank my club, the Rotary Club of Nairobi, for the base and the foundation on which I was able to, therefore, as Rotary International's representative to UNICEF, join the NBCC. It has been a very enriching experience, and I want to thank Maggie for that. We've been able to support the country in terms of the hand washing stations and interventions on education and behavior change that we've put in place as Rotary. So great was our contribution that at one point, the minister or the cabinet secretary for health actually addressed Rotary clubs in Kenya. And I think probably NBCC was on that call. We've also had the opportunity to address with others, including the UNDP, ResRep, several segments of the Kenyan society, and even speak at the UNGA. We had a special session at the UNGA this year. So we want to continue this engagement, Maggie, and perhaps we can strategize after this talk on the key issues that Rotarians have raised and the key sectors where we can, with Rotarians in those sectors, engage. You've heard the flower industry, the fruit industry. You've heard other questions about testing. Rotarians are asking this because they're involved in these sectors. So let's take up the gauntlet and think how we can involve them, bring them to the table. We still have a lot to do. The COVID-2 variant, the new variant is already amongst us. And there's every reason for us to continue with the message about prevention and prepare so that in the future, if any other pandemic comes, we are better prepared. Thank you.
Thank you so much, Ambassador Dr. Josephine. Thank you, Ms. Maggie. Thank you all. And I will now bring this meeting to an end. I do have a message which has come in from Professor Michael Hopkins, who was also very grateful for this wonderful meeting. And thank you. We look forward to engaging further. Thank you so much.
Bye, thank you.
Thank you.
President Ritesh, it looks like Dr. Mukesh had a question. I don't know if it's going to be taken as some.
That was the question which he had asked. He had inboxed.
All right. Okay. All right.
But Ambassador Josephine, yes, sorry, I had lost a connectivity at the beginning of the conversation.